All right, good morning, Professor and classmates. My name is Reuben Neri. Um, I will be presenting the healthcare system of France. So this is France flag right here. Uh, I think France is a very small country, as you can see here in the map. Uh, there are only 67.2 million French uh, as compared to the 327 million Americans. So they're not even a quarter of the population of the U.S. The quality of healthcare in 2000, the World Health Organization ranked France number one out of the 191 countries in their latest report. This became an issue because this is the first time that the World Health Organization ranked each country, the 191 countries, but a lot of issues came about asking them what were their methodology in ranking the countries or what kind of process did they use. So, with that being said, after that, a lot of they became more specific on what they're looking at in terms of ranking the quality of healthcare in the countries. So OECD ranked the best 5 year cancer survival rates was France. Then they narrowed it down to the breast cancer, and France was one of the leading countries that had the great survival rates. Another factor they were looking at is life expectancy from birth is 79 years old for males and 85 years old for females. So that's one of the factors they're looking at. And in July 2017, a New York Commonwealth Fund ranked France out of the 11 industrialized countries, number 10, second to the UK. And I'll show you a graph saying why they had this output or outcome of the ranking. So 11 being the highest and 1 being the lowest. So France ranked number 10 next to UK. Healthcare coverage. So the France has a carte vitale that covers 100% of essential care for most severe conditions, cancer, diabetes, and other care. Uh, and they don't have upfront payments. It's waived by the government or private health insurer. So basically, this says you will get you get treated or you get your services first before you know all the accounting of the cost of the healthcare is going to happen. So usually it's 7% for doctor fees, 80% for hospital fees, some 100% for some long-term and major illness. This is how many percent that the carte vitale covers. That means that 30% and 20% for hospital fees will be from your own pocket. And the remainder of the charges are paid by individual or a supplementary private health insurance through a top up. So basically, that's on you. And here is the graph I was telling about. The United States health consumption expenditure per capita in US dollars is a 10,224. So basically, that's per person, how much the estimated cost. Total population versus the total expenditure, how much money they spent for that year for healthcare. And you can see the average is around 5,280, and you can see France is around 4,902, well below the average, but it's like less than half of the US. And as you can see, the UK as expenditure is only like 4,246. Hence, in that study I just mentioned a while ago, they ranked number 11 or not the best, or number one in that case. This is what the Carte Vitale card looks like. You present this as how they would use once you access the healthcare uh, services. Just to give you an idea how the structure of their healthcare system is amazing. All right, total expenditure, like I said, in percentage in GDP is 11% of their total expenditure for everything. So for healthcare, it's only 11%. And then if you put that in dollars, it's 4,902 per capita. And um, let's talk about how the cost of the contribution. They call it the Social Security contribution, and actually it's kind of hefty. It's 21% of the salary, but 30% is paid by the employer, which I think is good, and 8% is individual contribution. But that being said, it gives the companies or employers a harder time to expand or to even put up a business in France because that hefty 30% is a mandatory contribution by the employer and only 8% for the employee. All right, this is the How it looks like, how the spending of the total, not just the government, but also the private. You can see the United States is almost like 50-50. Half of the spending is private, half is public. And you can see France is around, I want to say, only, uh, I, I want to say 70% is or 75% or 80%, in fact, is from uh, the government instead of the private. As you can see, it's not a lot for the private spending. All right, the freedom of choice. Uh, it's amazing. 95% of French nationals have healthcare coverage. Uh, and unfortunately, it's an obligatory social security contribution deducted by the government. But I think this is one of the things that we should be looking into as compared to the ACA, because I think that is the reason why they have a 95% healthcare coverage in total population, which our goal is the universal healthcare. All right, your employer will have to register in France to CPAM. Unfortunately, I can't pronounce what CPAM means, and RSI if self-employed. All right, you must register the primary healthcare provider or doctor in the healthcare system and register it in the government for before you can get full reimbursement for whatever services that you need. That being said, these primary doctors are your gateway providers. So if you want to seek a specialist, or they must refer you to get full reimbursements. Otherwise, uh, you will be getting all those costs. It will be out of your pocket. So I think it's great. I think that's how they control the cost. People can't just go seek whatever they want. They feel like, I want to see a specialist. The doctor would have to give you the green signal, or your chosen primary care provider. That's pretty much it. I kind of narrowed it down. This is actually, I want to say, my 10th or 11th take. Uh, it's really hard to talk about a great healthcare system, a country that has a system that really works, and narrow it down to 5 minutes. I hope you enjoyed my presentation, and these are my references, just in case if you want to learn more about the healthcare system of France. Thank you, and you guys have a great day.